Hello everybody and welcome to the Healthtech Podcast, bringing you the top health tech news stories and analysis every week. I'm Belle, and with me today I've got SomX's very own James and Amy joining me to discuss some of the best health tech news, supported by Daisy stepping in on producer duties as Adam has decided to jet off for some winter sun. Yes, I'm sitting here in my thermals and knitwear. No, I'm not at all bitter. James, Amy, how are you doing this week? Any particular highlights, health tech or otherwise?
I'm doing well, but I feel like it has been a week of maladies and illnesses all round. But I've been okay, but I had a kind of mystery illness. So I don't even know what it was. And I couldn't even describe it. So I just had to say I'm not feeling very well. I'm just not feeling very well. But apart from that, it's been a good week. Otherwise, how have you been?
It's been all right. Yeah, you're right though. Going into London for 3 days, like you're just rolling the dice with like everyone coughing and spluttering on the tube. Just grim. It's yeah. Now that I live in the countryside, well, sort of countryside.
Sorry,
Suburbs.
Yeah, sorry. Yeah, it's hardly countryside, is it? Well, some of it is. At least I can go to the countryside. I just don't like going to very packed tubes anymore, and I just don't have the immune system for it.
It's funny, my boyfriend always says that he grew up in the countryside. And as someone who grew up at the very end of the country, I just refuse to believe it. I'm like, it was hot. You grew up in a town in Hertfordshire. Like, it doesn't count.
Yeah, you had tarmac roads. You can't.
It doesn't count. You've either got coast on like, you know, half of the surrounding borders or nothing. Brilliant. So I don't think there were any sort of events or anything happening this week. We had a really jam-packed agenda last week. And I know, James, you went off on all sorts of lively debate about debate. So in the spirit of that, I know we've talked at length about wearables recently, but I thought we'd begin this week's Pigeon by kicking off with a story from the BBC, highlighting some doctors' wariness about the rise of wearables. Now, that is our aforementioned promised tongue twister. So for all the positives, wearables encourage good habits. They equip people with the numbers to back up very real health concerns they have. But this article highlights that some doctors are worrying that we are building a society of hypochondria and over-monitoring of our bodies, where normal temporary abnormalities, e.g. an increased heart rate, could lead to people having symptoms which could then be exacerbated even further by stress or worry about said symptoms. So leading to this rise of people worrying about things, which leads to them going further. And then we're just left caught in this cycle of worry. On the flip side, people aren't being alerted to potentially more worrying health concerns, such as cancers or things which can't be captured on that. So it puts people into a false sense of security where they think they're being very proactive about monitoring their health, but actually only a cluster of measurable things are being captured. This article also cites a lack of reporting on false positives. Technology companies are very keen to show the success stories of their monitoring software, but less keen to show when that's led to a false positive and potentially clinical things that didn't need to happen. The article also cites a lack of reporting on false positives, e.g. heart rate data from the Apple Watch, and fluctuations in reporting due to battery signal moving around too much, which can reduce the reliability of data. People like to talk about the success stories of their technology, but are far less forward when it comes to reporting on the false positives and the issues that can come off the back of them. So in that spirit, we often on this podcast that empowering people with their health data and a move towards preventative community-based healthcare can only be a good thing. But James, Amy, I'm curious to hear your thoughts on this, both from a clinical perspective and also the consumer perspective, because I thought this article was really interesting this week. We're in the BBC, but we're talking to doctors about very real concerns about this rather than reporting on interesting marketing trends and uptake of people wearing watches and rings and all the marketing that we see saturated on our feeds. What do you think?
I think there's a lot to unpack in it. I think what we've got to work out is overall, is it more beneficial than it is negative? Because anything that's coming in that's new, that's integrating new forms of data, that's getting people to report taking charge of their own health, I think there's always going to be some side effect. Well, there's always going to be some impacts that we potentially haven't planned for, or we don't know, like the false positives, for example, and maybe that data isn't going to be readily available. And to be honest, how easy is it going to be to measure that? That's one of my questions. I mean, how are we actually going to quantify how it's impacting people on this broader level? But I think generally it's around education and communication, and it's got to be tech companies that are supplying rings like Aura and other wearable devices working really closely with clinicians and people to educate on the accuracy pieces, and also differentiate the clinical side from the patient taking charge of their data side, because I think they are still separate, and it's valuable to not get them intertwined, because I think that the article is talking a little bit about this, like, are people relying too much on the data that they're going to miss, that their own data from these devices, they're going to miss bigger, more serious health conditions like cancer tumors and things like that. So I'm interested to hear what James thinks too, but I think it's about communication, and it's about being also honest around the accuracy and the potential of the technologies, like an honest representation of what they can actually do and what they can actually monitor, rather than too much of a future gazing piece of what they could do. Yeah, those are my initial vague thoughts.
Yeah, I do agree. I think we've talked about this on this podcast a lot. I think this takes it a little bit further. The fact that the BBC is reporting on it, I think, is interesting. That this is really hitting consumer media, frankly. Like, normal people are now interested in this. And I think that speaks to the fact that these big tech companies have got incredible distribution to the entire public. They've got like an amazing ability to put medical devices in the hands of everybody. But I find and I feel at the minute that heart rate variability is getting so much attention and press as like a metric that, I mean, I don't even think I heard that at all in medical school. And like, the public now have access to something which seems in between a gimmick and a serious device. Because is what we're saying that we're giving everybody a serious medical device to monitor their, let's say, ECG, right? In my medical training, if you had concerns over someone's heart and their heart rhythms, they had dizzy episodes or something like that, you'd give them a 24-hour tape, so a 24-hour ECG. You'd send them home with a big device that they carry around with them with, the electrodes on them, and you'd take a 24-hour trace, and then you'd make a decision off the back of that. What we're now saying is that you've got a version of that on you all the time. And the way that the healthcare system interacts with just the relationship between big tech and consumers, which are just creating all of this data, the actual healthcare system hasn't been built with this in mind. We still have a very, very, very separate healthcare system that you then go to with some of this data and say, hey, here's a thing that might need looking at, or please help with this. And so, to a point that you raised, Belle, about the response, I think there's a responsibility on tech companies to talk about sensitivity and specificity that I don't think it is talked about in those terms to consumers, to the public. And so a very, very, very sensitive test will produce a lot of false positives if it's not a very, very specific test. And that's the thing. One criticism of health tech broadly as it relates to consumers is you're going to flood the system with more people, the worried well, the false positives, all that sort of stuff. And so I think there is a responsibility to talk about specificity and appropriate signposting and all of these different things. Now, you're right, Amy. It might be that overall there is a benefit, because actually, whilst you might bring more people to the healthcare system with a perceived problem, okay, most of them might not have anything, but some might, and for those people it might end up being a real net positive, and actually that might economically form a model and blah blah blah. If it was a model, then arguably there'd be a screening process anyway, but maybe this provides justification for a screening process, or maybe the phone is the screening process, or a live call or phone case, or like whatever it is. So there's a lot there. The other thing as well is, it's a really interesting point that I hadn't considered about this false sense of security against the more serious symptoms. I think there's an assumption. You're right. There's definitely an assumption that I wear an Aura ring, I use the Apple Health app, I track everything, I do this, I do that, I look at all my data, here's my sleep score, here's my this, here's my that. I take these pills and, all that sort of stuff. I think, yeah, you're right. There's going to be a group of people for whom they think that is staying healthy, ignoring the bleeding gums or the dizziness spell, or like whatever it is. Again, that's quite anecdotal, but I think that certainly is something that needs exploring. I think my overall conclusion on this, though, is that what I just talked about there, and a few of the other bits, there's holes in this whole system as it should work together for me. And I think we might be now entering an era where a serious thing that is trained in healthcare staff from the moment of being a student upwards is that this is the way the world works. We have consumer devices that can do a lead 2 ECG trace. And so we need to build a healthcare system around that, with also the fact that there's going to be future advancements along this line, along this route. And so some element of forward planning for workforce and the types of clinicians that we might want and need, but also the healthcare structure itself and what we want from that, and actually bringing in clinical pathways that have some of this consumer data built into the entire system. It seems like we might be there.
Yeah, it's an interesting one, isn't it? Because yes, there's this real want and need to bring it in right now at this point in time. We've got people using these rings, these watches. The article talks about GPs having people come in and saying, look at this data. So there is a real need to do that now. But then also the new model of whatever watch will come out next year and the year after, and the types of data being collected is changing all the time. So when you're thinking of like actually robust data sets that we can make real decisions on and train our workforce on, we don't quite know what that's going to be yet. And I think this speaks to the point you mentioned that we're still somewhere between gimmick and medical device. Now, if you sent someone home with a thing to measure their blood pressure, they know that's a piece of medical equipment. They'll do it properly. They'll read the instructions. They'll sit still. They'll stay calm. They'll do that at whatever intervals that a GP has told them to. But when you've just got something on you all the time, you're not worried about it being necessarily good. You just know that it's there, ticking away in the background. And I wonder if as well, and I think it's really interesting that the BBC's picked this up now. Like, we are in the run up to Christmas. I can't imagine how many people have rings and watches on their Christmas lists. Samsung's got a new ring out. Also, like, I keep getting advertised. And, we've got all this technology coming to the fore, and yes, it can feel gimmicky. You've got kids wanting it because their favourite influencers are using them on TikTok. And how valuable is that? Is that a good thing to embed good health behaviours in people when they're still young? Or is that going to lead to a culture of people who are just used to tracking everything and feeling really hyper aware of everything in their body as a result, which can lead to some positive things, but lots of negatives as well. I wonder if this rise that we've seen recently in things like annual health checkups that you do privately with Neko Health and things like that, if that's actually the direction of embedding this into a more clinical setup, because people they can bring their data to that, but they're getting the medical level scans, which they don't have to worry that they've missed something because they're getting the 360 and doctors are carrying that out. I wonder if that's the trajectory we're going in. And I've heard recently, I know she didn't mention them by name, but if you followed the story of Davina McCall, and she'd had a private health scan, and I assume it's with Neco Health, it might not have been, and she found a brain tumour, and it wasn't cancerous, but she's had that removed off the back of it. So
it probably wasn't Neco,
incredible.
just because it was, I imagine it was MRI, so I imagine it was one of the other ones.
But really interesting that we're now seeing these kind of high profile use cases of these preventative scans leading to diagnoses which people wouldn't have expected. Davina McCall's an incredibly healthy person. She's released cookbooks and training apps and all sorts. I'm sure she captures things on smartwatches and things all the time and feels very equipped with her health data. Yet that went unnoticed because it was asymptomatic at that point in time. That's taking us down a completely new direction, I do appreciate. But yeah, anything from either of you?
Well, there's an interesting one really recently, which is that I believe the Apple AirPods now do a medical device standard hearing test, or
That's
operate
insane.
as a hearing aid, don't they? They got 510k in the US, I believe, for this now, the latest AirPods. Maybe look that up and fact check
Let's
me.
do a little Google.
Yeah, here we go.
Yeah, the FDA's approved it.
There you go.
The hearing aid feature.
But yeah, so that's happened. So what does that mean now? Let's say that happened in the UK. All of a sudden, Apple switch on a feature, and all of a sudden now you can do a full hearing test using your AirPods. And okay.
I think in general, it feels like a great movement to empower these new tests that people can take and data. But there is this sort of deep concern inside me that people that have access to these kind of technologies is a very small, like it's a particular subset of society. People that have AirPods and Oura rings versus people that don't and wouldn't be able to afford to buy them or wouldn't have access to them, even thinking more worldwide in other developing countries and things like that, where they might not even have access to this kind of technology at all. Is it going to further inequalities in healthcare, in that some people will have the best healthcare on their devices and others will be left behind? That's a concern I have around the wearables. But maybe there's also a counter argument that the wearables will be, deployed to other communities, and it might enable easier access to healthcare as well. So there's two strands to it, but it is a concern.
Yeah, I totally agree. And that leads us nicely to our next story, actually, which talks a lot to people's attitudes towards health, technologies and data. All right, I want to shift gears now then, and let's talk about some fascinating insights from the Health Foundation's recent report on public attitudes towards health technologies and data. They've surveyed 7,201 people across the UK, highlighting a real mix of optimism and concern when it comes to the role of tech in healthcare. I'm going to just outline some of the key stats, and then I'm going to throw it across to you two. Amy, I know you've looked at this in a bit of detail, so I'd be keen to hear your thoughts. But some headline stats here. 51% of the public think technology improves the quality of healthcare, compared with just 8% who thinks it's making healthcare quality worse. 2/3 of the public have high or moderate levels of trust in the NHS with their health data. And almost half of people, 48%, are happy for the NHS to see health data stored in their phones, but are far less happy to share information through social media, such as shopping habits and things. Then 75% of the public are happy to share at least some of their data for the development of AI systems in the NHS. However, 25% are not happy for any of their data to be used. And speaking to the point that you just raised at the end of that, Amy, there are some interesting findings within different socioeconomic groups. So groups D and E in the reports, that's semi-skilled and unskilled manual workers, or casual or lowest grade workers who depend on the welfare state for their income are far less positive about the impact of technology than those in other socioeconomic groups. They're significantly less likely to support the use of any of their healthcare data being used for AI development, and they're significantly less willing to take part in the kinds of research development activities that would support the development of this. So lots of really interesting things here. And there's some interesting insights into differences with age as well. So some people are hesitant that technologies may be brought in to distance the care between clinicians and their patients. And older groups in particular are concerned about distancing themselves from their family GPs. And yeah, to kind of finalize as well, that last point, yeah, they're hesitant about technologies that might be seen to distance from healthcare staff, such as care robots, is what they've named, citing the ability to see and talk to NHS staff when needed as their most important consideration when thinking about technology use in healthcare. So I think for any developers of technology that is hoping to get into the NHS in the UK, having that clinical support embedded into it is going to be really key for some of these older audiences in particular that really, really want that personal support and are far less likely to rely wholly on technology to give them that healthcare data and support. So yeah, opinions are divided, and AI in particular as well has brought lots of excitement to reduce clinical workload, speed up processes, but there's the fear that will, what that means for the actual human touch that people get during, we've talked about this at length on this before. It's so important that you feel that you can trust the person you're talking to, because it's such an intimate moment when you're sharing not only your health, but your health scares, your health concerns. Like going into a doctor's surgery when there's something that you think's actually wrong with you is one of the scariest things. And AI in some ways and technology is brilliant because it means that you can kind of probe that without necessarily embarrassment or diving into them. But at the same time, there's a real implicit level of trust that is needed sometimes to delve deep enough for clinicians to really understand some of the underlying things which technology would struggle to catch or to pick up on. So loads of food for thought there. I'm going to go to you first, Amy, because I know you've read this. And then James, I'd love your thoughts as well.
Yeah, thanks, Belle. A few initial thoughts I had reading it. I wanted to touch on the robots thing because I think it just first because essentially the stats that came out of that piece, it's looking at the type of technology and what people would be okay with and what people are less okay with when talking about tech adoption and things like that. And it's interesting that, the more personal it gets, the less willing people feel to want to hand that over to AI. And I think, to your point, I think it's really important that, as we kind of look at the kinds of areas that we're going to give, like we know that we have to transform the NHS digitally, and we are doing that. But it's really important to make sure that we're doing it in the right places for people, that they don't feel distanced from the healthcare and they don't feel left behind. And I think it links to the social groups stuff that we spoke about. Just really, like, as we make this quite big transition that we're trying to do with implementing tech in the right spaces, that groups don't get left behind, and the fact that they're less willing to take part in research is also a concern. Like, how do we make sure that their views are included and that we know that the technology that is being adopted is actually helping the people that need the help? Because otherwise, it's going to become a much more fractured system. It might be improving, speeding up diagnosis in some areas, but then leaving communities behind. So I think just really important to consider. And data like this is really interesting because it sheds light on the different types of things that people might be feeling. And also gives us a bit of a kind of view into what the future of healthcare could look like and should look like. you know, when we think historically back to you having your local GP as a kind of familiar face, you'd see the same person every time and they'd know your family and know your history. And that's changed as things have kind of segmented and the structure of the NHS changed, and you know, doctors would move around more, and that personal touch has been lost a bit for people. And maybe this is like, it highlights that need to bring it back to, let's focus on what's important for healthcare for the human to take control of, which is that piece of personal familiarity, comfort. Because AI is not going to give you that. And even if you had a robot who could actually perform some quite complex tasks, which I think we're pretty far away from at the moment. But I would love to hear if you had further thoughts on that. But, you know, we've heard some stories about like robot, but I think we're very far away from that. But even if we did, it's not going to give people what they want. So yeah, just like using technology in the right places, making sure that we account for those who really need it, and yeah, making sure they're included in all of this research is like super important, I think. But yeah, I don't know if James, you've got.
Yeah, I mean,
I'm sure you have thoughts.
Well, listen, like, isn't the Health Foundation wonderful for like doing this sort of work? Like the way that they've written this with those socioeconomic groups in mind, I think is really interesting. So rather than just saying we surveyed 7,201 people from the public, it's no, we've surveyed 7,201 people from the public stratified across these different groups because this is what we want to put the attention on. And so they've obviously made an assumption about correlations there of certain socioeconomic groups answering differently, and they've obviously found that correlation that they were expecting, which is obviously why they stratified it like that in the first place. And I think it obviously speaks to the motivations of the Health Foundation as well to actually get to the root cause of the issue, because you're right, Amy, that what is it that we want here? Like, we want to improve healthcare, but okay, let's do what the Health Foundation have done and just take socioeconomic groups as our stratified population. What does improving healthcare mean? You know, ABC ones, do we want to, you know, do you want to make healthcare better for them? Give them an extra year or two because we're doing daily blood tests on them and giving them every piece of tech going? Or do we actually want to go at the other end and go, hold on a minute, these people don't trust the healthcare system. They don't want to give their data to the healthcare system. They don't even want to participate in research to do with healthcare. And so actually, if we follow the path of least resistance and just build tech based on the information that we have, great, we're going to get rich people to live 5 years longer. Meanwhile, there's the forgotten population that's just getting worse. And so I think that's just a fascinating thing that the Health Foundation have done here in the way that they framed this, because it's also not very preachy to that end at all. It's just, here are the statistics, here's the evidence, and almost invites you to do that thinking of like, what do you think the answer is here? That's sort of how I read the executive summary at the start. It's sort of like, well, key points, here's the key points. And then just leaves the gap for you to kind of draw the obvious conclusion at the end of it, which I think is very nice. I think it's funny that you don't need to interview 7,000 people to make me hesitant about care robots. is the other thing. That point particularly was stating somewhat of the obvious. However, basically, software and hardware in a certain way can make clinicians' lives easier and free them up to do the caring. Because you're right. I think in some way, we do want to keep that care and empathy in the healthcare system that can only be delivered by humans. As I've said before, there are 3 types of empathy, and AI can fake one type of empathy incredibly well, cognitive empathy. It's very good at faking cognitive empathy. it cannot show emotional empathy, or it cannot feel emotional empathy, and therefore it also doesn't have a motivation, so it has no motivational empathy. So actually true empathy will never be experienced between a human and an AI. And so yes, we always need to be putting the humans into healthcare for all the reasons that you said, plus the fact that humans deliver better history to humans when they feel full empathy, and that actually gets better the more they interact with the same clinician, and the bigger the bond, the better the history taking. To your point, Belle, about embarrassment and all these things that can be overcome, although it's an easy first lift with AI, can be overcome over time by building a relationship with a human, and lots of other reasons. There's better clinical outcomes, there's less hospital stay, there's loads of evidence to do with empathy. So yeah, I'm sold that basically all we need to be doing is creating space for more humans in healthcare, and we do that through technology. The other reflection that I had just quickly was that the BMJ Future Health event that I went to recently was a really interesting event, because it was, I don't want to say for beginners in health tech, that sounds a bit patronizing, but like, it wasn't for your typical healthcare crowd. It was there was a lot of clinicians there that were not wanting to start their own tech companies, not wanting to be sold to by tech companies, but just wanted to hear what other clinicians were doing with technology for the benefit of patients. And I choose that phrase very carefully, because their motivation for being there was only, how do I make my clinical practice better for patients? They're not interested in the way the tech works. They're not interested in what company has built it. They're not interested in how cool it is or what flashy marketing they've got. They don't care about any of that. And it was interesting because, like, in the sessions that I was in, the people that put their hands up were clinicians that generally asked the same question of the people on stage, which was, yeah, but what about, and then they described the situation pointing to one of these socioeconomic groups here. And that's fascinating for me, because this report mirrors that reality. Because as this report says, those socioeconomic groups are being left behind. And the reality in that room was anecdotally people sticking their hands up going, yeah, but I've got a load of people that are being left behind. And so there's just this fascinating marry up there of like, this isn't just words and numbers on a page. If I can get people listening to read this, these are real people in the real world really being left behind right now, and potentially more so in the future. The data isn't from them. It's not about them. Things aren't being built for them as a result. And that's making them even more alienated because they're not part of this community. And therefore, they're just getting further and further behind. So exactly to your point, Amy, like that gap is at risk of being widened. And I don't think we've figured this out yet in health tech. I take your argument, or the flip side to your argument that you mentioned about this trickle down that people talk about. You know, we advance technology, it gets cheaper, and therefore it can go to everyone else. I get it. And yes, okay, that I guess is happening to a point. We all have iPhones, we all have these things in our hands now. Like, if you do have AirPods, albeit expensive, there is a group that can now afford them, and they'll be second hand at some point. They'll be cheaper and cheaper and cheaper. So like ear care and like, I get it. But as that advances, does the top end advance even quicker? Probably yes also. So is the gap getting wider? Probably yes also. Don't have any answers, but like, it's been an interesting few weeks actually, listening to all this stuff and seeing this on paper.
Yeah, and I think like what technology offers is one thing. And as we put our focus on funding, and we just need to make sure we don't leave the other aspects behind, which we've discussed. But yeah, it's definitely very interesting and concerning in some ways.
It's funny as well, like, you know, as I mention all the time and have already mentioned today, I grew up in a rural part of the country, and that's often you have specific socioeconomic groups that are more, prevalent in those parts of the country than cities as well. You're far more likely to see those lower socioeconomic groups than the higher ones. And it's not then just a case of that. It's also exacerbated by physical access to care. So it might take you an hour to get to your nearest hospital instead of a 10-minute walk, and it's an hour drive, or it's a train that's delayed, or it's a bus that's delayed, or whatever. And technology has a huge ability to really positively impact these areas by helping people get access when to stop them having to make these trips and go in. That's a really good thing. But as the systems become more reliant on data and consumer-led tracking and monitoring and things, that's when a real problem occurs, because you can't rely on those people, like you say, having access to those at-home technologies and things like that. But the hospital or GP clinic or whatever might be set up in a way that they're really trying to optimize for that. And that's when I think there's a real worry, because these places are struggling already with access to care. And yes, I genuinely do think tech can do brilliant things, but we just need to be so mindful of all these interconnecting bits. Like, we can't just think of healthcare with regards to gender or age or socioeconomic strata or ethnicity. Like, all these things are interconnected, and it's so important that research like this continues to happen, so that we are aware of all those different demographics when designing not just the healthcare technologies, but then the policies and all the other connected things that are going to actually impact how people get access to quality healthcare.
Having the time to care enough about your health to go and even want a wearable is a privilege, let alone then to be able to afford it and all those things. And so, yeah, you're right. You keep going upstream of this, and then you're into like housing, food, education, and then you're into like others. Like, it's all so connected. It's a similar reflection I have with a lot of these kind of like Health Foundation-esque reports, is that you end up looking at it and then you end up trying to get to root cause all the time, and it just sends you back
to another thing.
Exactly. It just keeps sending you back to like housing, education, food, like that. These are the components of health, and there's all the social determinants of health. Like, information is now a social determinant of health, so education clearly matters. And I don't know. It's such a difficult problem to solve. But what I would say is that reports like this make sure that people like us talk about it. It just makes it part of the conversation. And so, like, culturally, I think we can all, by talking about this stuff, you can just do your bit to influencing behavior at large, just reminding people that this is a thing, like starting little projects that can help. And then it's all part of a bigger wave of activity, isn't it? And you can create an incentive just by group think or group desire, because as a group you will then judge other groups and organizations and companies and all the rest of it. If we just make this a thing of like, if someone, those people that stuck their hands up at BMJ Future Health, they didn't have to do that, but because they do that, it then makes a few of us in the room think about it, and then we go and ask a few more people some more things, and then eventually something gets started, and it's nice. I think it's good.
That trickle down of conversation is so important as well, because as much as we love our health tech pigeon listeners, we do know that you are probably all working in the health tech space, and you've got a reason to be plugged into this. But after having this conversation, hopefully we're all more likely to go away and talk about this with our families at Christmas and things like that as well. And for people that are working outside of healthcare or health tech, or just aren't as, not going to be reading a Health Foundation report, it's so important that we've got this so that we can start those conversations as well. Because if we are going to really change attitudes towards this, and we don't have to, by the way, we could keep attitudes as it is and design for those, or there's the flip side where we try and change public attitudes because we think that's for the greater good. But we can't do that if people aren't talking about, which is why then seeing things being published in the BBC and things is so promising, because it is part of this much greater conversation. And hopefully you get more momentum towards these good things. All right, so I think we're going to wrap it up there today. We did have a third story, but you'll have to read Healthtech Pigeon if you want to read it and all the rest. So thank you, James and Amy, for all your thoughts. Thank you, Daisy, for keeping us in check in the background. Don't forget to subscribe to Healthtech Pigeon and Biotech Dodo for your best health tech and biotech news stories of the week. Please like and subscribe and have a wonderful weekend.